New studies are shedding light on the repercussions of missed healthcare screenings as millions of people stay at home. One America's Jenn Pellegrino has more on a telemedicine solution.
We're here with Dr. Jonathan Baugh and Adam Hardage of Remote Health Solutions. Dr. John, Adam, thanks so much for taking time to join us today.
Absolutely, thanks.
Thank you.
Telehealth has been in the news quite a bit lately. There's a quote here from Seema Verma with the COVID task force. She spoke a couple of weeks ago. Let's take a listen to that.
But the reality is not everything can be addressed by telehealth. There may be a woman that needs surgery for breast cancer, somebody who has cataracts in their eyes that need to be able to see better. And sometimes a doctor just needs to be able to listen to their patient's heart.
Well, I think most people think about telehealth classically as that ability to talk to your doctor on the phone and be able to get advice maybe. And I think that's one of the maybe the biggest misperceptions of what telehealth is. And our ability now to be able to get a video and a voice and collect data, vital signs, heart rate, listen to their lungs, all of that information that I would do in a live, in-person examination is now capable with the right technology.
I would say, too, the way we look at it as a company is the big difference between telehealth and telemedicine. Telehealth is the ability to see and talk, and telemedicine is the ability to remotely diagnose, I would say. And Dr. Baugh, on the other end, is in southern Utah. We're here in Washington, D.C., and that is running over a cellular connection, and all we need is some way to get to the internet anywhere in the world.
So Dr. John, could you walk us through the steps you would take if Stefan here said, I'm not feeling so well today, should I go into the office or not?
Yeah, you know, the first things that I want to know with a patient, and we'll take this COVID-19 because that's all on our minds right now. The things that I want to know about the patient is, one, how is he feeling, what's he concerned about, and has he had an exposure that is concerning? And then I want to start knowing about his clinical symptoms. Does he have a cough? Does he have a fever? Does he feel short of breath? Is he having a loss of taste or smell? All those other questions that we are now learning relate to COVID-19. In this situation, the first thing I want to know is, well, what's his temperature? Here we can see that right now, live, Stefan's temperature is 98.6. And then the second thing I want to know is what's his oxygen saturation? What's his heart rate? We can see right now his oxygen saturation is 99%. That is fantastic. We can also see that his heart rate is about 85 beats per minute, somewhere in that range as it kind of goes back and forth a little bit. The next thing that I want to know is I want to listen to his heart. I want to listen to his lungs as far as COVID-19 goes, especially, and as far as him coming in to the office, whether or not that's going to happen. And we did that just a minute ago, and we saw how easy that is as well. Those are the things that I want to know about this patient.
Dr. John, as a lot of folks are getting ready to go back to work in different phases, telemedicine could be very effective in workplace settings. Could it be used in this situation, and how?
Yeah, you know, there's a couple of levels of ways that we use this in conjunction with workplace scenarios. And some of it is the ability to see and evaluate a patient in their home before they come into work when they have a question about whether they should go to work. And the other is to be able to actually have a small telemedicine room or quarter or something at work where we have technology there, and we can reach out to a network of physicians when they have a question. Most places that you go into work, in a hospital, for instance, maybe just taking your temperature before you come into work. We can do that same thing plus more for any business anywhere in the world because of new technology, the ability to be able to keep your coworkers safe and be able to keep their families safe as well.
Well, Dr. Jonathan Baugh, Adam Hardage, Stefan, thank you all for taking time to be with us.
Thanks so much. Appreciate you having us, Jim.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube. And call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.